All right, it's 5 o'clock. Welcome to the September 20th Human Services Committee meeting. First order of business is to approve the minutes of August 16th. Do I have a motion to approve the minutes?
Second.
And Elizabeth second. All in favor?
Aye.
Okay. Next is the privilege of the floor. Do we have anybody here to speak to the privilege of the floor? Seeing none, we will move to the first proposed resolution, which is confirm the reappointments of the Chautauqua Opportunities Board of Directors. Mr. Feldman.
Hello, James Feldman from the County Executive's Office. So we have 5 board members up for reappointment this year. They have all indicated that they would like to serve another 1-year term, and that is Rebecca Bremagen, Marie Karuba, Kevin Whitaker, legislator Bob Binkowski, and Natalie Lakowiak.
Okay, all good people. Anybody have any comments or questions?
Just to echo what you said, Mr. Chairman, all good people.
All right,
Agreed.
all in favor?
Aye.
Okay. Opposed? Nobody? Thank you. Proposed resolution number 2, to authorize the acceptance of aging and disability vaccination collaborative funding for Chautauqua County.
Okay.
Dr. Marianne Spanos, Chautauqua County OFAS Director.
Dana Corwin, Deputy Director, OFAS.
Okay.
So, our National Association, U.S. Aging, was given a pot of money to distribute to the AAAs, which we are an area agency on aging, to work with partners to continue the great vaccination efforts that we have helped with during the pandemic. And it seems pretty timely with the little resurgence going on of COVID, but this vaccination grant is also focused on not only COVID, but flu, and really working with underserved populations. So I'll let Dana tell you about the different partners that we are partnering with.
Right. Thank you for having us tonight. We've been talking with a variety of community partners and how to roll out these grant funds in and around incentivizing and increasing the number of vaccinations in Chautauqua County. So we've been talking initially with the Department of Health, the Chautauqua Center, Mental Health and Hygiene, my goodness, the United Way with the IDA Coalition. And we feel like our conversations from the last month are really showing us a very clear pathway to improving vaccinations in the county.
So
The
if you
delivery of the vaccinations?
Yes. So we have been granted $286,000 over the next 8 months till April
April 15th.
of 2024 to get about
2,500.
2,500 shots, working with these different partners. So once we know if you approve that money coming in, it will be it's not used to purchase the actual vaccination, because many of our partners can bill for that. It is for providing incentives to clients to get the vaccine, to send different partners out into the community to talk about vaccines and really get good understanding amongst these underserved populations. So to provide, we can use it for advertising and, to help fund, since the vaccine is covered, but maybe not the staff costs. We could cover staff costs. We could cover using a mobile unit, gas, everything that goes into being able to provide a clinic somewhere.
Right. we're rather excited about it because I think it will really increase the rate of not only flu, but possibly COVID when those vaccinations become available locally. We're still hearing that COVID, the newest round of COVID vaccination booster, is not available locally. If there's anything different
Unless-
from that, we're looking for
Unless Dr. Falk has better information.
looking for a confirmation up there.
I think last week it became available,
Right.
but there's, you know,
Locally.
as far as I know, physicians' offices, the health department, the pharmacies are still waiting for it.
So the program in the outreach into the communities, particularly the marginalized communities, we envision doing this through the IDA coalition workers. So really investing in these community ambassadors to go into African American and Hispanic and Latino communities that they live and dwell in, and provide an opportunity to provide education to them about what the vaccine can help them with. And then the grant provides some financial bonuses to those who actually do go through and get their COVID vaccine or their flu vaccines.
And it's shingles as well, and pneumonia, or
Originally, yes.
Yeah.
We can do those. The incentives are more, we found out today, the incentives are supposed to be used though for COVID or flu. So we can still promote the use of those as well.
So how do
And
you
even
promote it
RSV.
and advertise it? You were talking about going into those communities. What do you do in general for advertising the,
Well, we haven't started yet because we need you all to accept the
what would you
funding,
do,
but
I guess is the better question,
you know,
right?
there's a lot of different things, you know, besides flyers and Facebook. And we are working with all the housing units, and we hope to be able to do clinics right at the housing unit. So the service coordinators there are like really our best ambassadors, because you know,
Sure.
word of mouth. And that's why we really want to work with the IDEA Coalition. They already have these ambassadors going out. And if we can pay some of their time to talk about, you know, the importance of getting vaccinated, especially when a lot of those communities have underlying conditions that really put them vulnerable to severe complications from COVID or flu.
So the people who come obviously then don't have to pay for the vaccine. right?
No.
And are you working through primary care physicians at all? Or?
We're talking about that. We're really waiting now on all of you to, and, you know, we've just been talking, you know, as we said, to our fellow county departments, you know, the IDEA Coalition. I have a call into one of the regional managers for a pharmacy to see, you know, what the opportunities are. But definitely, you know, we will look at, you know, physicians' offices too. But we do have to target, you know, they want to see us going to disabled and underserved populations.
So the word needs to get out that people who don't have insurance or can't afford it, this is a place where they can go and
Yeah,
get
well,
them.
all of, you know, most people have insurance, but if they didn't, they could go to the Chautauqua Center too,
Right.
or through the health department. Yeah. They
Is this a one-time grant? I
Um,
mean, is it renewable or do we?
not that
know?
I know
Not that we
of.
know of. It's been a rolling grant since December, I think, of last year. They've been taking on new grantees. Hopefully, it would continue every year because the flu and
Yeah.
pneumonia and shingles are still, you know, and
I
COVID.
think these monies came originally from the CDC. It's kind of the first time they've flowed from the CDC through the Administration for Community Living to our national organization, US Aging. So I guess it depends on how well we do.
It's great, yeah. Good luck.
But I think they all really recognize that during COVID, we were a critical partner to getting the older adult population vaccinated, and that's why this opportunity is available to us.
It's great.
So this is, when you go out in the community, it's open to everybody. Nobody will be denied as far as that goes. And okay.
We've been-
And you will be utilizing the county mobile unit.
We will, yeah, you know, where it's appropriate, we will use the county mobile unit, mostly when we will need those county nurses, you know. So we don't necessarily need the mobile unit because we can set up mobile flu clinics anywhere, but if it makes sense, we will certainly use and be able to pay for the use of the, whatever it costs to send
think-
that mobile unit out, if that's what you're talking about.
Yeah, I think it'd be a good collaboration, don't
Mhm.
you think, Dr. Falk, to get
Yeah.
that
And that's
mobile
what we
unit out
actually.
there. And
met
We're
with the
certainly,
department.
we're certainly open to that.
Yeah.
As I discussed before, we're still waiting on the painful CON process with the state. So we wouldn't necessarily, at least, moving into the next couple of months, wouldn't be able to, provide immunizations inside the vehicle. But,
we can
utilize
showcase.
it in other ways.
Yeah.
Right.
So we're open
And that
to
was a
those
conversation that we had with a small group, Emergency Operations Services, Deputy Director at the Department of Health and their nursing staff, to see what the possibilities are.
And we did write that into the grant so that we would have that covered, that cost for them.
Great. Thank you.
So is this targeted towards the elderly or is it?
It
for-
can be, it can be anybody of any age. We're not going to turn anybody away. We've learned today we're not going to give incentives to children,
No. well,
but it's supposed to be for aging and disabled of any age. But anyone, yes.
And low poverty areas, obviously.
Yeah. Okay.
And you said it would get approximately 2,500 vaccinations?
That's our goal.
Yep. That's the goal for the life of this grant, is that we want to get 2,500 vaccinations in arms.
And and the costs are, do you bill your time in administering it?
Yeah, certainly. But that's probably the least amount
No, I-
of this, yeah. Of the grant.
Talk about Newark Connects in that respect.
No. No, we'll take a piece for admin and
Yeah.
certainly,
Okay.
and make sure that all of our costs are covered. But we're really trying to put the bulk of this into, getting people to get the shots.
But you're actually still refining the whole structure of the program.
Right.
And
We have
finding partners,
some
additional
flexibility.
partners.
We don't want to count our chickens either before they're hatched. So we're waiting for your blessing. But
Yeah.
we've had a lot of preliminary conversations because we need to hit the ground running with
Yeah.
this.
And this is, the COVID shot would be that most updated, which,
That's what, we hope in the next couple weeks that it will be available and we'll have that because I know my neighbors are looking for it. I don't know about yours.
And the flu is,
Flu.
a very acceptable annual immunization that a lot of
Right.
people are comfortable with. And this is around the time that you would start flu
Oh, yeah.
immunization. So, we certainly can roll with what's available and then add in as we go.
is it flu and pneumonia combined or is it separated? Sometimes
I think it's 2 different shots,
Okay.
flu and pneumonia.
it has been combined though before, hasn't it?
You have to ask the
I
doctor.
have not heard of a
Yeah,
combined
I
flu
haven't
and
either.
pneumonia shot.
Maybe that's an urban myth. I don't know.
Someday it would be nice to have a combined flu COVID
True.
vaccination.
Yeah.
But to my knowledge, I haven't, you can get them both at the same
Right.
time, the flu and pneumonia.
That's what I was going to
Those are
suggest.
eligible.
Okay.
Yeah, you can get one in each arm, but some people don't tolerate that very well.
Okay.
I have a question, sure.
Sure. Yeah.
I think it's important to note that it is an incentive program. So could you give us an example of what an incentive is, please?
Hmm.
I think that's an important.
So when
aspect of
we
this.
were learning about the grant at the national level, they gave examples and a general budget, so kind of guidance. And the acceptable amount of incentive is $25 per vaccine.
But we are going to provide those in local gift cards, like for Target, Tops, Walmart, or Wegmans, we were thinking.
So there's a big portion of your expense, Marty, is the
Right.
incentive. Someone will
Incentive to take a
receive
shot.
a gift card to Wegmans for $15 for getting a vaccine.
Yeah.
So that's.
You said
that's
that
the
at the
expense.
beginning and I thought about it and I
Okay.
completely.
Yeah.
Yeah.
But,
That
and then
was my next
that,
question too.
Well,
I
it's-
we'd
yeah.
rather give local,
Sure.
uh,
Right.
rather than like Amazon gift card, we want that money to then be reinvested locally. So we thought that
For
that would
food
be
and-
for food and necessities. Yeah.
Is that part of the grant requirement, that they have an incentive?
I don't know if it's required, but it's very much promoted. You know, whatever you can do, you know, you can say whatever you want about you know, should we incentivize people to do the right thing? But I think at this point in time, there are some people that would make a difference to. So, you know, if a $25 gift card is going to make you say yes to protecting your health, you know, we're happy that we
So
can do
it's
it.
Gone beyond donuts or a free hot dog.
Right.
And it's, if you travel across our borders into PA, many of the grocery stores there offer an in-house gift card. If you go, I think it's,
Giant Eagle.
thank you, Giant Eagle.
Just got the email. today.
Yep. They offer, it's $5 or $10.
Perks, yeah. Yep.
So, you know, I would imagine that across the nation, that's a popular model of offering an incentive to help you make a decision to protect your health. I mean, ultimately, it's the patient's decision, but we want to be able to provide information and education. And that would be our main focus.
And it was interesting when we were talking to the Chautauqua Center that, you know, they think that would tip it. You know, they talk a lot to people about vaccines and low income people. This might, you know, tip the scales for them. So.
Because it's a vulnerable population.
Mhm.
Just, I'm thinking, you know, how come it's not enough that the shot is free?
I know. I wish it was too,
Yeah.
but
I know.
you know.
So whatever works, I guess, is the answer.
And we're just happy that we have this opportunity to, you know, provide this essential service for more people in our community.
Okay. Any other questions, concerns?
Maybe even like a gas card. I mean, you know,
Could
to
do
get to
that
the
too.
next.
Yeah. Certainly
So,
nowadays with the
yeah.
price of gas, that's
Yeah, that's
Yeah,
going up
a
again.
great
So.
idea.
You can have a choice.
Mhm.
This one
We
is
were
nice.
thinking about,
Right.
you know, getting a variety and letting them choose.
Be nice.
Mhm.
Anything else? Okay. All in favor?
Aye.
Opposed? Okay. Thank you.
Thank you. Good luck with it.
Thank you.
Good idea on the gas card.
Okay. Next up on the agenda is a discussion with the Division of Temporary Assistance with Ms. Anderson. I don't know, got mine.
Sorry.
Making a ruckus.
I know it. Jeez.
I got one.
I'm Diane
Yeah,
Anderson
printed it
from
out. Thank
Temporary
you.
Assistance. I'm the Director of Temporary Assistance. And I'm reporting on the May information. Our participation rate is a little behind the times for when we can get that information. So the rest of state participation rate in May was 8.3%, and our rate in May was 5.6%. So we rank 31 out of 57 counties, or 26th in the state for the highest rate. So for the month of May, 28 individuals were participating and counting in the participation rate. And the total number of recipients who were engaged was 146. And that number is counted, that includes the number, the 28, the initial 28 that were counting in the rate. So there were 118 families who were participating in activities, but not enough to count. The participation rate of the non-exempt individuals would be 8.3%, if that's all we looked at, is the people that were in the non-exempt category. We sent 41 conciliation notices out in the month of May, and those go out when someone is not participating in work activities up to the maximum number of required hours. 30 sanctions were processed during the month of May for failure to comply with the employment activities. A total of 50 individuals were in sanction status as of May, and 32 of those individuals were beyond the duration. So they could have done something to end the sanction, but chose not to. And all of those individuals counted in the participation rate calculation, because they do count after a certain amount of time. I think it's 3 months they start counting in our rate, even though we cannot do anything to, force the issue of having them in activities.
And that adversely affects, it says?
Yes, yeah. The next category is the exempt, non-exempt, and as of May, the number of exempt individuals again exceeded the number of non-exempt. So there were 833 total exempt and 610 non-exempt. And of those 610 non-exempt, 338 were in the all families category. Of course, 28 are participating and counting, and 118 were engaged, but not enough to count. Of the 833 individuals who were exempt, 291 were in the all families category. And 160 individuals who were exempt were counted in the participation rate calculation. So even though we are not able to require them to participate in work activities, they still counted in the rate. So. The IMA report is the last attachment on your handout. And this is also for the month of May. There were 98 people referred to IMA for an assessment. 53 people showed for the assessment, resulting in a 45.9% no-show rate. Of the 53 individuals who were assessed, 5 did not comply with the interview. 17 did not meet criteria for treatment. 14 were already engaged in treatment and will now be monitored by IMA, and 17 will be referred for treatment. The temporary assistance caseload, while the TA caseload shows a decrease since 2012, it has increased from January to August by 101 cases. And that is mostly safety net cases that has increased. It did also increase. I looked at 2022. It had increased by 184 cases in that last year. It's difficult to know the reason for that, but we have some ideas about why that may have occurred. The 45-day waiting period for cash assistance ended in October of 22. Also, I think bail reform has had some impact on that because people are not staying in jail for a long period of time. We've also continued to have an increase of homeless individuals. And if someone wants placement for homelessness, then they have to apply for assistance. And the larger category of people that we're finding that are homeless are in the safety net category, so single individuals. The SNAP cases have increased since 2012 when we first started reporting on this, but have really remained fairly stable over the past couple of years. It's right around 11,000 cases, and that really doesn't move too much. It goes up and down a bit. And the number of applications did increase in May from the number that we saw in April. It really fluctuates from month to month. And we continue to deny approximately 40% of applications for failure to comply with the requirements of the program.
40%. Okay.
Yeah, it's right around that number each month, but that's pretty high. I think that's the highest percentage that we've had so far.
How do they fail to comply?
So it could be a number of things. Could be that they don't get documents into us because we need, a a lot of documents to prove that they're eligible or who's in their household, their identity, things like that. Some of it can also be appointments that they're required to keep. So they could be scheduled for drug and alcohol assessment, those kind of thing, employment assessment. So if they don't keep those appointments, then we would be denying the case. The temporary housing information for the month of May, there were a total of 139 cases in temporary housing. And of the 139 cases, 51 were single males, 49 were single females, and 39 were families. One individual was on parole or recently released from jail, and there were 23 individuals or families placed in temporary housing due to Code Blue in the month of May. And the cost of temporary housing for the month of May was $171,815.30. And yeah, I will tell you recently, even as the last few weeks, the week of 8/28, we had 41 people come in that week alone because they were homeless. And the week of 9/4, we had 43. And last week we had 59. This week from Monday until noon on Tuesday, we had 24. So it is getting increasingly difficult to see everyone and find placement for them.
Do you have any comment on the issue with the Falconer housing and the hotel out there about what's happening there, what might happen, and anything from your perspective? Because you deal with this all the time.
Right. We've met with some officials from the city of Falconer and some of the business owners and understand their frustration. We have limited space to put people though. So, we are always looking for other options for people. And of course, we want people to be in a shelter environment instead of the hotel. But those are longer term initiatives and they've been going on for years. We hope that next year we'll have the women's facility and that the Chautauqua Opportunities is working on. And that'll be right in Jamestown. So that will help somewhat. We send as many people as we can to the UCAN mission, which is also in the city of Jamestown. And that's a lot of the argument that we hear from people is that they should be closer to the services. But it's difficult, to find enough housing to house this number of people.
Mhm.
So we kind of have to go with wherever we can find availability.
Sure, I understand that a lot of these people have failed other opportunities and don't have much of anywhere to go, but I know one of the concerns is the people who have mental health issues.
Mhm.
And should they be in those kind of facilities? And that's one of the questions we're getting from the residents in the Falconer area.
Mhm.
Is there some other option for them?
Yeah, unfortunately, there isn't another option. We are having conversations with different places to see if there's a way to provide on-site services of mental health services. But those are, fairly new discussions. So, but hopefully something will come of that because, we recognize that a hotel is not the best place to put someone that's having issues with their mental illness or even substance abuse, issues. So we'd like to put more supports around the area that people are housed. But like I said, that's a work in progress.
So you're cultivating some other options or trying to find some other places?
Yes.
I
Yes.
don't envy your position. That's really difficult.
Yeah.
Thank you for the work you do with that.
Yeah,
You're
absolutely.
welcome.
I can't believe you even want to put families into a motel or a hotel, but
Right.
you have
Yeah.
no other options with
Exactly. Yeah.
housing scarce and expensive.
Yeah. And of course, UCAN had looked at opening a women and children's facility and then had some issues with the building. So they are in the process of selling that building and looking for another, but they have assured us that they're still interested in locating some kind of space and housing that population. So of course, that'll be longer term. But it takes time, but we are making progress. It just doesn't show yet.
How much does the migrant situation affect what you're doing?
We haven't had a lot of migrants. We did have some back in, I think it was the beginning of the year. We had some, but that was fairly new, and most didn't continue to be eligible because their parole status expired. So I don't know that, that might change, because it very well could change with if we get an influx of people coming in. So that would be dependent upon whether or not they were eligible for assistance, if we would need to get involved in placement there.
Because at some point they might be, once they get through the system and they're eligible after the probation period, if you will, passes.
Right. Yeah.
So if you had discussions about what to do when that floodgate opens?
We've had some initial conversations about that. I wasn't in on the last one, so I haven't had a chance to catch up on what if anything was decided on that. But we'll definitely be talking about that more in the months to come. So
Yeah, good.
it's
'Cause
definitely a
that's-
concern. We're having trouble enough
Yeah,
housing the population that we have in the county. So
Sure.
Is there any kind of drug, alcohol, or mental evaluation completed on people that are requesting temporary housing? And do they have to pass any sort of
yes,
screening?
yeah, the temporary housing rules are the same as the temporary assistance rules. So they are screened for drug and alcohol. And they are asked about mental health issues when they go into temporary housing, just so that we can try to link them to services if they're not in services. So if we screen someone for drug and alcohol, let's say, and they, look like they need an assessment, we'll refer them on to IMA, and they will do an assessment to determine if they need to, start treatment, continue treatment, or
But
if
they
don't
still
need
receive
it.
temporary housing.
As long
even-
as they're complying, yes.
Is part of, I know UCAN has some pretty strict rules, correct?
They have, yes, they do,
And
yes.
if they don't follow those rules, and
They,
then we have to.
they do end up on a list of people that are sometimes banned, and they will work with us if there's really a need for somebody and we have no other option. They have opened up their doors and given somebody another chance. But the banned list has been an issue. We did meet with them recently and hope to improve on that.
Yeah.
But yeah,
Well, as Elizabeth said, I don't envy your position. I know
we're
you're-
busy, that's for sure.
Yeah, and I have full faith and confidence that you are doing what you're supposed to be doing, and you're doing a good job. I believe that the county executive is working his best to do it, so.
Yeah, it
it's-
takes all of us for sure.
Yeah, absolutely. So anyhow, continue on.
Okay.
Unless there's other.
Just a comment too, I suppose if there's I'm sure you always are in the market or in the push for more support from the state in this area, especially when it comes to funds
Yes.
to help fund these. We just hear like the $254,000 grant to give out some incentive to get someone to take a vaccine. Why doesn't the state come out with some sort of grant program for someone to start some temporary housing that actually has some teeth?
Right.
Put a program out there for $1 million for these communities. I'm sure people or an organization could be created or people. There's already places in our, if UCAN has a reason they're probably slow at getting places is funds,
Mhm.
So if we could help them somehow with acquiring some grants, that would be helpful, but they probably don't exist. Otherwise they have got.
Yeah, there are some, and Chautauqua Opportunities has utilized some of the HHAP, can't remember what that stands for, something to do with housing, funds to help them get their facility up and running. But really what we'd like to see is the rents become more affordable for someone on assistance, because that's been a lot of what we're seeing now is, the rents haven't increased since, I think, 2003 on temporary assistance. And a single person would get $167 a month for their shelter amount. And that, even the total grant that goes up to about 400 is not going to rent an apartment.
Why is there such a lag with that amount?
They don't increase those very often. I think before that, it probably hadn't increased since, I want to say, the 80s. But someone from the New York Public Welfare Association, who we work very closely with, has sent them a letter, the governor a letter that, we need to see an increase in this. I mean, we prefer to have people in their own apartments, their own homes, instead of this influx of everyone being in temporary housing. That's not the best for people.
Is there anything this body could do to help you with that effort too, to get that amount increased? Let us know. I'm sure we can provide a letter from the committee or some sort to help that fight. 2003's 20 years. It's time for
Yeah.
them to increase that number.
Yeah.
Inflation alone is
Yeah, I mean,
Yeah,
even an
triple to
efficiency
whatever.
apartment is $600.
Yeah.
So that's well out of their range for someone who's on assistance. So yeah, we'll let you know if there's something that we think would be helpful there.
Great point.
Okay.
Thank you so much
Okay,
for all your
You're
work.
welcome.
Yep.
Thank you.
Appreciate it.
There, I did it again.
I did it too. Okay, now we have a discussion on the coroner update from Dr. Falk.
Dr. Mike Falk, Chautauqua County's Chief Medical Officer and Interim Public Health Director. Give me a moment here to get the computer logged down again.
I get that screen at home all the time. It's trouble.
You need to check the device power.
Let's see here. Hopefully we can get this moving along. So as many of you may recall, almost a year ago, we had a conversation about our coroners program and some of the challenges that we were up against, specifically in retention and recruitment, but mostly retention of our coroners. It is a difficult job. It's a lot of time commitment, and it just doesn't pay well. And, I actually presented a proposal to increase the overall pay rate for the coroners back a little over a year ago. We obviously have had time to, hash things through, do some research, really look at how we wanted to approach the coroner program. The coroner program came online with the health department back in roughly about 2019. At that time, the administration realized that we didn't have appropriate resources in coroners physicians. That's when myself and Dr. Walters became involved with the coroner program. And over the last, 9 months or so, we have worked with our coroners and other health administration to really try to determine what we really truly need in our program moving forward. I wanted to give a little bit of a rundown of kind of where we are now and sort of some of the ideas that we have come up with. We're coming into a budget presentation here soon. And there are some things reflected in that budget proposal with the coroner program. But I wanted to have enough time to sort of explain, what that was all about. Okay. This is our crew. All 6 are nurses. Very different than the makeup of our coroner program in years past. Myself and Dr. Walters rely heavily on our coroners to understand pathophysiology, disease process, medications, medical terminology to help determine cause of death. Jen Wilcox is a nurse practitioner who was just hired here within the last week or so. Desiree Vera is an RN with emergency medicine experience. Dan Tyler and Ken Haley are both RNs with a vast amount of administrative experience in the hospital. Ruth Mendez, who's based out of Dunkirk, is a nurse from Puerto Rico who's actively working on her New York State license as an RN right now. And Amy Newhall is an RN that works at UPMC Chautauqua and with Stat Medevac. All but Ken are really new coroners within the last 4 years. Most of them are brand new within the last 1.5 years, which gets us back to the stability of the program and retention, the retention problem that we've had in the past. Myself and Dr. Walters as coroners physicians who sign off on any kind of natural deaths. We certify those deaths, anything outside of a medical examiner's case. So we obviously know what a coroner is, and in Chautauqua County, the coroner has jurisdiction over really any death, especially those that are sudden, suspicious, but also the natural deaths that occur outside of the nursing homes, outside of hospice care, and outside of the hospitals, other than the sudden deaths that happen within an emergency department setting. It might be easier for me to tell you what a coroner is not, and what a coroner has been sort of viewed as over the last however many years. And that is, a coroner is not somebody who goes to a scene and scoops up a body and takes it to the funeral home. A coroner has a lot of responsibility and a lot of jurisdiction over a death scene. Not only pronouncing and determining time of death, but investigating the scene, ruling out any suspicious activity that may be indicative of a homicide or a suicide. They do take full custody of the body, working closely with our police agencies, making positive identifications of the deceased, locating next of kin, working on death certificates, filing reports, communicating with the ME's office. One single case is a minimum of 3 hours of work, and that's for a simple case. There are cases that we've had within the last several months that could involve up to 10 to 12 hours worth of on-scene work due to investigations. Our coroner cases are increasing for a variety of reasons. Number one, drug overdoses are on a sharp rise, as we all know. Since the pandemic, a lot of people held off on their primary care and such. We face this national phenomenon now where acuity is much higher. Patients that are presenting to the hospitals are much sicker with much more advanced disease, and that unfortunately continues now. The autopsy cases have increased. I think we ran some numbers. Obviously the drug overdoses are increasing, but also suicide rates are increasing. Just within 1 year, from 21 to 22, they went from 7 jumped up to 11, I think are the rough figures that we looked at today. So typically, suicides and drug overdoses, we have typically referred to the medical examiner's office for accurate death reporting and toxicological testing.
Dr. Bob,
Yeah.
when is an autopsy required?
So an autopsy is based on a decision that the coroner would have with one of us as coroner's physicians. So, we would typically send, any kind of homicide for sure. You need a very detailed medical examiner report from a board certified forensic pathologist who does nothing but autopsies. The DA, the police agencies, everyone would expect and require a very detailed death reporting via an autopsy. So we have typically sent over the last several years suicides, mainly because we don't want to miss a homicide. So there's a lot of things that a forensic pathologist is going to look for that'll help them determine suicide versus homicide. Drug overdoses that we've typically sent to the medical examiner's office. A lot of that is because there's a trend, at least nationally, that federal prosecutors especially are looking at prosecuting drug dealers in drug overdose cases. So the DAs that are prosecuting these individuals tend to want very comprehensive and complex toxicology screening. And therefore, we have sort of elected to send a lot of those cases to the medical examiner's office. Personally, I feel we may have some opportunities, and we'll get to that here in a minute with what we're proposing, to sort of keep some of these cases, prevent some of these cases from going to the medical examiner's office, which, by the way, run us about close to $3,000 every time we send somebody up. And that's all local share taxpayer dollars. We have no revenue sources within the coroner program,
And I'm sorry.
no
I'm
state
wondering,
aid or anything.
What's the difference then between what the coroner does and what the medical examiner does?
So the coroner, the medical examiner would, so basically what happens is a decedent would be transported to Buffalo and a full autopsy would be done. So that is an internal and external full examination
By the ME.
by the medical examiner, who is a board certified forensic pathologist, who is a physician. Okay. That is their specialty. That is what they do, forensic pathology and death investigation. A coroner does not do autopsies. A coroner can document, the scene, document external findings, but they would not have the ability to do any sort of advanced imaging or internal examinations and such. That's the difference, yeah. And we haven't had in Chautauqua County anybody doing autopsies for several decades, probably. Forensic pathologists are few and far between, and they tend to stay in big cities. Over the last 7 years or so, drug overdose deaths in Chautauqua County have doubled. I am absolutely convinced that they would probably be, even higher without all of the efforts from everybody in the community addressing this problem. Fentanyl has thrown a big monkey wrench into this problem, and highly addictive, very deadly. Our numbers could be 2, 3, 4, 5 times higher than that if all the efforts within the county were not happening. So the challenges that we have, number one, are retention. There's a lot of turnover. It's difficult work. It's not a lot of pay. Our coroners are currently covering 12 to 13 call days every month, which means that pretty much all day, they're typically 12-hour shifts. They're committed to the county. They can go to the store, or they can kind of do things around the house, but they have to be able to respond immediately to a death scene. And again, when a call does come in, it may be one call, it may be 2 or 3 calls. They're a minimum of a 3-hour commitment. The work is obviously difficult, and it's becoming exceedingly difficult to cover weekday shifts. The average coroner makes $16,000 a year in our county. That's about a $6,000 stipend and a case rate of $150 per case. It doesn't matter if the case takes them 3 hours or 3 days, they still get $150 for that case. And so, as you can imagine, all of them have other jobs. And so the most of those jobs are occurring during the week, and it's difficult to cover those weekday shifts, so much so that I've had the pleasure of covering some of those call days myself during the week as part of my duties within the county. And I'm happy to do that. Coroner's physician, thanks to our legal attorney's advice, coroner's physician can function as a coroner within the county. So the county is has seen a significant increase in complex coroner cases. We are looking at and proposing a full-time management position for added program oversight, improved stability and structure, and potential cost savings to the program as we move forward into the next couple of years. One of the so really what we're looking at is all of our coroners are part-time. They all just kind of cover shifts. We don't have anybody providing that administrative oversight. When Bree Agate left last year, when she resigned, all of the administrative duties fell to the assistant to the director. And that has been delegated out to another health department staff member as well. But that was over and above all of the other duties that they were already doing. So one of the idea that we have is to bring on a full-time coroner supervisor, which would be a 35-hour-a-week position within the county. We started this idea working through this with HR back early in the year. And because there's such a wide variability of coroner duties and coroner pay and coroner structures and frameworks across the state, every county is very different. It was difficult, has been difficult for the human resources to sort of put together a job title and a sort of a job duty statement. But we're actively working with them and I think becoming very, very close. And it's looking like it's going to be more of a coroner supervisor type of position. So one of the things that they would do is respond to death investigations Monday through Friday, business hours type of thing. That's about 42% of our cases. So right there, that's, roughly about $27,000 or so, if I'm remembering correctly, that we would not be paying a case rate to another coroner. Okay.
What kind of experience or qualifications would you expect for that position?
Well, as you can see, the six current coroners are all people with extensive medical experience. At least a couple have forensic experience and education. My expectation is that they have a solid foundation and knowledge of disease, pathophysiology, medications, and medical terminology. We've had great coroners over the years, don't get me wrong. We've had a lot of funeral directors as coroners, and nothing against the funeral director as a coroner, but what I need as a coroner's physician is somebody with a very solid background of medical knowledge.
How realistic is it to get the person you need, the qualifications with that kind of a salary?
Well, we haven't got to the salary part yet. We're not going to be hiring a full-time person for $16,000 a year. So
Okay.
hold that thought just for a minute, and I'll kind of get to that. So again, on average, 42% of the coroner calls take place Monday through Friday, 8 to 4. What is this new individual going to do? They're going to respond to death investigations, supervise the coroners and support staff, develop policies and procedures, which, we don't have a lot of active policy and procedure development at this point, assisting with program budget, assisting with securing vendors and communicating with vendors and contract holders, working collaboratively with other county agencies, especially police agencies, the forensic investigation team, and providing education on safety practices, et cetera. So that this individual would supervise anywhere from 3 to 5 other individuals. So the considerations, and we'll kind of go through this here in a minute. And we have another meeting at 6, right? There's another group in 6. Okay, so I'll try to wrap up. But the other consideration is, remember that we're not paying a case rate for about 40% of the cases. It's about $27,000. In our budget, we reallocated a public health nurse to offset the cost of this position. So we, as you'll find out in a week or a couple weeks, we have reduced 4 FTEs. One of these was reallocated to this position. Now, full disclosure, public health nurse position does get some state reimbursement. So we're looking probably at a savings at least of about $40,000 to go towards the new position. We may have the potential eventually to send fewer cases for autopsy. Right now, that's running us close to $400,000, and that's what we're going to have budgeted for 2024. $400,000 contractual cost just for medical examiners fees. I think we have some opportunities there. And we won't spend much time on the transport cost, but right now we're paying, we as taxpayers are paying $475 to transport somebody to Erie County Medical Examiner's office. I can easily, if we have a full-time person, that person could easily take those transports themselves for the most part. If we have a vehicle that we had for the corner program, it would at the very, very least pay for itself, if not save us some money doing our own the majority of our own transports. That's a different conversation for a different day. A lot of variability throughout the counties. All right. The counties in blue are ones with similar populations and ones that we kind of looked at. You can see Chautauqua County on the left. That's the average pay for our county coroner, $16,000. Several counties are a lot more than that. Several counties are less than that. Kind of in the middle of the pack there for the most part. Average case rate, and this is case rate plus stipend averaged out. So $238 a case for Chautauqua County. Broome County's upwards of $356. Niagara County, interestingly, is down at $84. And you can see there that they actually have the highest number of cases, 301 cases per coroner, which is high. I'm not sure if that person has much of a life outside of their job doing that.
They don't have any money to pay for anything.
Right. Right. So this is kind of the bottom line, right? A new position estimated cost with salary and fringe, you're looking at $90,000 a year. So probably $60,000 salary plus the fringe. We're not going to be assigning that $150 case rate for those 140 cases to somebody else. So that $23,700 comes off that bottom line. We've reallocated that RN position, which gives us about $40,000. It's not going to happen in 2024, but maybe 2025, 2026, we can start looking at potential savings in medical examiner fees, maybe upwards of $40,000. And projected savings in transportation fees, like I said, at the very least, I think we can break even, but we might even be able to find a few $1,000 there. So I think all in all, with that reallocation of the RN position, we're, looking at a kind of from a budget year-to-year comparison, I think we're looking at least a break-even type of situation here. There may be opportunities as we redevelop the framework of our coroner program. We may find that we don't need 6 coroners. I think that we need them now, and they're all doing a very important job. We do have 2 coroners that are kind of half-time, part-time. That makes sense. But we need to figure out how we can, put these pieces of the puzzle together. And so we may be able to find some additional cost savings there. But what we're really striving for is stability in the program. Worst case scenario, all the coroners quit except for our full-time person. We can at least cover the schedule between myself, Dr. Walters, and the full-time coroner supervisor. We've had situations in the past, and you guys can correct me if I'm wrong, where the coroners have all walked off the job. And that could happen, and it's not hard for them to do that at $6,000 stipend per year. So, questions?
I remember them coming here doing a presentation like it was yesterday, and they brought up some good points. And obviously, you guys got a great plan and goal here, and I like it. I mean, you've been working hard on it, obviously, and appreciate your hard work.
Last year when we came to the legislature, we were really looking at a higher case rate and higher stipends for everybody. I'm not convinced, and while they deserve it, and we might have to have those conversations for a few of the corners maybe next year, but we need the framework and a solid, stable program to start. And I think that this allows us, the potential to start getting there.
I think so.
Nice job.
Thank you.
Thank you.
Welcome. Thank you. We appreciate your time. November, December, it'll be the fight against opioids and opioid settlement funds. And we, health department and mental hygiene want to spend some time with you guys after kind of budget stuff to start looking at how we're going to be attacking this. We have some ideas we want to pitch to you.
Thanks again.
Okay. We do have two other things in the other category. Two late resolutions. Okay. So they're on your desk. I guess, don't know which one's first, but I'll just say the amend Chautauqua County Department of Mental Hygiene and Social Services 2023 budget for increased services for recipients costs.
Sure.
75,000.
Yep. Good evening. Sam Zafuto, fiscal supervisor. I do work for the fiscal restructure finance, but I'm assigned to social services in the health department. Yep. That resolution obviously is for the service for recipients. This is the non-TA residential domestic violence. This is not reimbursed by the state or federal government. This is moving some money. We are over budget at this time. There were some large expenditures earlier this summer. So this is moving some money from the contractual weekly Medicaid payments, which have, basically it's going to have a surplus of about 110,000 at the end of this year from the guidance we've got from the state, to add funds to this account to continue on through the rest of this year.
So this is budget neutral.
Yep.
Can you say what the unexpected big expenses
And I
were?
want to say unexpected. They were payments to the Salvation Army and some different locations. We also do have some charges that are through the foster care program for placement. So there was some expenditures for a child that was placed. There were some flights to Wisconsin and et cetera that obviously weren't planned for.
Those are planned for. But the Salvation Army expenses were.
Yeah, that's in there. It's
expected.
just above what the budget was for 2023.
That'll be adjusted for 24.
It is adjusted for 24.
Questions, concerns? All in favor?
Aye.
Aye.
The second one is to amend the Chautauqua County Department of Mental Hygiene and Social Services 2023 budget for increased emergency aid for adults costs.
Yep, as Diane was up here earlier, this is primarily going to be emergency aid for housing, utility payments. Obviously, she was up talking about that. This is the other piece. This is 50% reimbursed through the state, and then we are taking $42,500 from the A6010 social service admin to offset this to continue on through the rest of this year as well. And this too has been corrected and increased for the 2024 budget.
Questions? Concerns? All in favor?
Aye.
Aye.
Okay, thank you, Sam.
All right, thank you. Have a good
Thank
evening.
you.
Anything else? Motion to adjourn?
So moved.
Second?
I'll second.
Okay. Sorry.
Dan,